Hello, my name is Kaylin Anders. I'm going to be doing a neurovascular assessment. First things first, I'm going to walk into the room. I'm going to do hand hygiene. I'm going to provide privacy for the patient. And then I want to do 2 identifiers. So I'm going to ask him his name and date of birth. For privacy reasons, he's not going to state it. And then after that, I'm going to do perception of position first. So, all right, so go ahead and close your eyes. And then I'm gonna lift up your finger and your toe, and then you're gonna tell me if it's up or down, okay?
Up.
Yep.
Down.
Yep. And then
Up. Down.
perfect. So you did good on that. And then the next assessment that I'm gonna do is I'm gonna have him put his hand out, close his eyes, and I'm going to put a object in his hand, and he's going to tell me what it is.
Is it a pen?
Yep. Good job. Go ahead and open your eyes. Next, I'm going to do the 2-point discrimination. So what I'm going to do is I'm going to do 2 points on his arm until I go all the way in until he feels 1 point. And then after that, I'm going to measure the distance of it real quick. So just let me know when you feel 1 point.
1.
Perfect. So that's about 1 millimeter, so everything is good there. For the next assessment, I'm going to go ahead and draw a letter in his hand, and then he's going to tell me what the letter is real quick. So just put your hand out, I'm going to draw a letter, and then you tell me what you think it is.
A.
Yep, good job. Alright, so next thing I'm going to do is I'm going to go ahead and touch a body part, and then he's going to tell me the location of where I'm touching him. So go ahead and close your eyes.
Hand.
Yep.
Leg. Foot.
Yep. Perfect. Alright, so everything's good there. The next assessment that I'm going to do is the bicep reflex, the patellar reflex, and then the plantar reflex. So I'm going to go ahead and find the tendon on his bicep. Alright, and then I'm going to go ahead and hit it, or just have it dangling, sorry. Perfect. And then, perfect. And then for the plantar reflex, I'm going to have you scoot back just a little bit so they can see. And I'm just going to brush my hand underneath his foot. And yep, if it moves, perfect, it did. So that's a positive reflex, that's good. While I'm down here, I'm going to go ahead and check for clonus. So I'm going to grab his foot, I'm going to pull up, and then when I release, everything's okay. It doesn't jerk back or anything, so that would be negative for clonus, which is good. Alright, so the next assessment is going to be cerebral function. So I'm going to have you stand up actually, and just go like this, or close your eyes, sorry, and then go ahead and do that. Yep. And then go a little faster. Perfect. That's good. So you can go ahead and have a seat. So that's a normal test. And then the last assessment that we're going to do is coordination. So I'm going to have you take your hands and just go like this on your knees. Yep, just like that. And go ahead and do it a little faster. Perfect. All right, and then the last one is going to be with the feet. So I'll just have you, yep, up and down, and then go a little faster. Perfect. All right, so I believe that is it for the neuro exam. I'll go ahead and make sure the patient is comfortable, wash my hands, do hand hygiene, and exit the room. Thank you.